the time of the recording of this video, 36 states and 4 territories in the United States have legalized cannabis, often known as marijuana, either for medical and/or recreational use. This has really created a conundrum for certainly patients, but also healthcare providers and healthcare institutions that are trying to comply with state laws that are often in direct contravention to federal policy and law. My name is Dr. Adam Perlman. I am the Director of Integrative Health and Well-Being for Mayo Clinic in Florida. And the title of the article is Medical Cannabis State and Federal Regulations Implications for United States Healthcare Entities. As many of you, I'm sure, are aware, over the last few years, there has been an increase in the use of marijuana by individuals within the United States. That use currently is anywhere from about 15 to 20% of the population. And when you look at certain subpopulations, such as patients with rheumatologic conditions, the use can be upwards of 40% for indications such as pain. As you may also be aware, there's also been a trend in legalization of marijuana, either for medical and/or recreational use by states that has increased to a place where now more than half of US states and territories have legalized marijuana for some particular indication. Of course, during the same period, the federal government has not officially changed their stand on marijuana. The DEA still considers marijuana to be a drug with high potential for abuse and no accepted medical indication. The FDA, although it has approved 3 synthetic forms, still treats marijuana as a Class 1 drug. And the perception of the public at times is in direct contradiction to, again, this view of the federal government in terms of the legality and the utility of marijuana. What this has done for those of us who are healthcare providers and for healthcare institutions in general is created really what amounts to a gray area, often that can be fraught with confusion, as both providers and institutions are trying to certainly respect the rights and protect the rights on a state level for our employees at times, certainly our patients, but also be in compliance with federal laws and regulations. Despite the increasing use of marijuana, often for medical indications, medical facilities may neither legally store nor possess cannabis, and certainly are required to comply with the Medicare conditions of participation, which really prohibit, again, the storing, distribution of cannabis. In addition, many institutions have zero tolerance employee policies, and this at times can run up against responsibilities, or at least perceived responsibilities, as it relates to the Americans with Disabilities Act, which requires reasonable accommodations. For example, perhaps for a patient or an employee rather who has cancer and is utilizing marijuana to treat nausea or other related symptoms. Of course, part of what is required is a much more robust body of literature to help us as healthcare providers, certainly help our patients and those institutions treating patients to really understand if medical cannabis is effective, and if so, for what indications, at what dose, and even in what formulation. Obviously, it can be inhaled, it can be taken topically, it can be taken orally, and we need much more research to fully understand if medical marijuana is effective, and if so, how we can best and most safely provide it for our patients. Restrictions and administrative burden have made it difficult at times. It is certainly getting easier, and hopefully in the future, we will have a better body of literature to help guide our clinical decisions. If you're interested in this topic and would like more information, please read the article for more details. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.